When talking about the need for Medicaid expansion, Governor Walker always mentions how much we're going to save through the prison system. The Alaska Department of Corrections estimates that 80% of the people under its jurisdiction suffer from alcohol and drug addiction. And looking at the latest data, we find that quality reformative programming, such as substance abuse and cognitive behavioral treatment for mental health, are an absolute necessity if the state's going to reduce its recidivism rate. The ADOC is the largest provider of mental health services. 65% of the population are Mental Health Trust Authority beneficiaries who are generally incarcerated longer and rearrested more often than the general population. One way to accomplish this end is Medicaid expansion and Medicaid rate reimbursements for those between 21 and 64 years of age who were not previously eligible for Medicaid services. This would allow those in the prison population to be eligible for substance abuse treatment through Medicaid.
We have about 40,000 Alaskans that aren't adequately covered with insurance. This gives those individuals an opportunity to get regular health care, improving their health, improving their productivity, and hopefully improving their ability to become or be productive members of our state.
Alaska has the third fastest prison population growth in the nation, according to a November 2014 Pew Public Safety fact sheet. It currently costs the state almost $58,000 a year per inmate.
Right now, federal government covers 100% and ultimately will cover 90%. And regardless of whether or not we still get support from the federal government, if we do not take care of people that aren't able to get insurance, we're going to be in a situation where we're taking care of them in the emergency room or other places at a much higher cost.
Alaska's prison population is growing 4 times faster than the state population, even though crime in Alaska has been on a steady decline during the same time period. Property crime is down 44%. Projections show that the state's inmate population will be over 6,000 by 2020.
Trying to take care of people while the problems are not as acute is actually going to save us money in the long run, regardless of whether it's a federal program or a state program.
95% of the ADOC's inmate population will be released from prison back into our communities. In 2013, an average of 377 convicted felons were released. With the current recidivism rate, that means of the 377 released, 238 will return to prison at a daily cost of $38,000 to the state.
We are already paying for it, yes.
Senator Pete Kelly, as the co-chair of the Senate Finance Committee, said earlier this week that he's jumped the fence and no longer supports Medicaid expansion. He was quoted as saying the current system, which is a huge part of the state health department's budget and a driver of the state operating budget, is broken, and he would want to see more reform work prior to adding more load on a struggling system. Reporting in Juneau, I'm Dorene Lorenz.